So Lori, what we're going to work on now is stretching your left arm and managing your muscle tone. Now initially, your arm was very floppy. You know, the muscles had no tone at all. And you went into a stage where you started to have some muscle tone, that's stage 2, and you started to have some movement in this pattern. Stage 3 tends to be the muscle tone gets higher and sometimes can dominate the arm and all its movement. So you're starting to move into that stage. The next stage that I'm going to help you keep moving through is where you can start to move in pattern, but also start moving out of pattern. So you can start opening your hand, straightening your arm, moving away from the body. So that's the next stage. The stage after that is where you can refine those movements so you have a more normal moving arm. So I'm going to help. The idea is to keep everything flexible and comfortable so that you could keep moving through these stages and not get stuck in any one spot. So what I'm going to have you do first is we're going to loosen up. Now right now you look great because again your knees, feet, trunk, you're very tall, straight, everything looks good. So usually I pay attention to how the whole body looks before I look at the arm. I'm going to have you do a thing where you're supporting your arm and you're shrugging and going up and down. So this arm is going to cradle this one. I'm going to help you at first. Shrug up, relax, exhale. 2 more of those, and relax. Very good. 1 more. So what we're doing is helping your shoulder blade not be stuck to your ribs, and getting those muscles around your shoulder blade to kind of move up, down, and we're going to move forward and back. The next thing I'm going to have you try, I'm going to put this soft ball right in the middle of your back. That feels all right? Mm-hmm. Next, I want you to stick your chest out and shoulders back. Very nice. That looks really good. So you're getting your shoulder blades to move from kind of being forward to being back like that. It activates these muscles right there. So I'm going to have you slump and do that again. Shoulders up and back. Very nice, and I'm helping a little bit. The next thing I want you to try is I'm going to have you shrug up and now push your elbow down. Perfect. Try that with this arm. Shrug up, push down. Push, 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 push. Very good. Now what I'm trying to get there is the muscles in your low back that stabilize the shoulder blade so it will stay put. Otherwise, when you start reaching, your upper traps tend to overhelp and reach like this. So we're trying to get these muscles down here to stabilize the shoulder. Now the next thing we're going to do is get the shoulder blade to move forward and move back like that. So this hand, I want you to reach down and touch that shin. So you can feel your shoulder blade come forward and your elbow straight, your wrist and fingers are straight. That looks perfect. You're going to try that with this hand. And keep your balance by kind of holding right there. Reach down and away. Perfect. Come up. Reach down. Pull your elbow up and back and look towards me. Pretty good. Try that again. Look down at your hand. Pull your elbow up and back. Very nice. Good. Now, it's hard for you to see that, but when you were stretching down like that, your arm was basically at a 90-degree angle to your body. So you stretched basically like that. The other way I can do that is have your hand here. Now push my knee away. Perfect. And that feels all right? Mm-hmm. Now again, when your family does this with you, they want to make sure everything's comfortable and they're comfortable. So right there, you got a nice big stretch right in here, plus your shoulder blade, because it's going with gravity, was right where it should be. Now, if I were to try to raise your arm up like this without doing all that preparation, you feel that pain? Mm-hmm. Yeah. So sometimes you get a pinch right in that just because the shoulder blade hasn't moved with this part of your arm. So if it goes down like this, and that's comfortable, mm-hmm. Good. So again, it may be painful if a person tries to do this or that. Ouch. Mm-hmm. Okay? So they let people know if they're doing something that's hurting. Also, if anybody's helping you, they should not try to move your body weight by pulling on your arm. Let's say you're going to roll over. If they grab your arm and say, here we go, tell them to stop and not to pull on your arm. If they come near your spine and help you move, that's better, but they should never pull this way. So we've worked on the shoulder. The elbow is rarely a problem. It's not a problem for you, but kind of going through the motions like this is good just to make sure. You may start, when you start walking, develop more muscle tone, and your arm may want to pull up like this. So your biceps may get overactive, so it's good to kind of ease it out and straight just to make sure it will. Now the next thing we're going to be careful with, just so we don't cause you any pain, but put this hand right here, this hand just like that. Now you can see the wrist is back, the fingers are straight, the elbow's straight, everything looks good. A lot of my patients, when they come back to see me, look like this. And this is just the perfect solution to that, is keeping all of these muscles right in here, their normal length, and nice and relaxed. So this looks good. The other thing that tends to happen is people spend most of their day palm down, all day, all night, just like that. So they can't roll their palm up. And you can see yours is a little bit stiff from there. Put that hand palm up. So you can see a difference there. Now I'm going to have you with this hand, hold onto this arm just like that. Your thumb is just in the right spot. You're going to gently roll this way. Whoa, that was nice. Your fingers opened. Looks good. So now in terms of stretching, for a person after a stroke, you should stretch gently for about 2 minutes. If you stretch for under 20 seconds, it's just like pulling a rubber band. It would just bounce right back. So I would stretch and hold, and let's say, and you want to be very gentle. If you're watching TV, you can say, well, every time there's a commercial, I'm going to stretch something for the length of the commercial. They're about 2 minutes long. So that would help. The other thing, if a person, you have very little swelling, so that looks good. If they have swelling, I'll address that in a different session, but I want to make sure that the fingers can close all the way, and yours close very nicely. But just checking to make sure the thumb and hand can open wide and close all the way. Good. So that looks good. Now, I forgot to say, when you do this, if you get pain in the wrist, you want to respect that. So if you did it that way, it'd probably be less painful, and you're working your way back there. But this is a good way to compromise on that. So it's a kind of a 24-hour job to maintain an arm after a stroke, but it's worth it in terms of keeping it comfortable, keeping the pain down, and getting it ready for the next stage. Good job. So Lori, we were just showing you some of the ways to stretch and keep your arm flexible when you were sitting in the chair. I'm going to show you now some things that you and your family can do when you're laying down to try to get the shoulder and arm in a good position. It's important when your family is helping you with this that they're in a comfortable position too. If they're kind of leaning over and straining, then you'll both kind of feel the strain of doing it that way. So they should be comfortable when they're helping you with this. So again, the arm tends to pull into the body, and we're going to go the opposite direction. So I'm going to bring it out towards me, and I'm going to gently open this hand and arm. Now what I want the right arm to do, it's going to model what the left arm should do. So this hand is going to be down by your side and roll it palm up. Like I said before, the arm tends to roll into the middle, and we're going to have both sides come like this. So this is kind of like a little restorative yoga thing that you're going to be doing right now, where you start right here, and you take about 5 real gentle, easy breaths, let everything be nice and relaxed. And then your family's going to help you move your arm up to here and imitate that with your right hand. And again, you're going to take about 5 or 6 easy breaths. And sometimes if you feel tense, it helps to kind of give a great big sigh. And sometimes that will melt the tension away. Now, if you yawned or sneezed, or if you're in pain, the arm tends to pull into the body like that. And your family, again, if you yawn, they just have to kind of wait that out and wait for the arm to relax again. And when they're moving your arm, they should move it very slowly. If they feel some tension, just stop, let that tension ease down, and then move forward from there. Now, from here, one thing they could try, we did some of this when you were sitting to get your shoulder relaxed, but I'm going to show you how to do that laying down. So this arm is right in my, between my arm and my ribs there, and I have my hand on your shoulder, and I'm just slowly loosening it up just like that. Again, when your family does this, they should be comfortable and not pull on your arm, but help the shoulder move this way. So we've loosened up your shoulder and we have your hand and wrist and elbow in a good position. What I'm going to do next is put this pillow here. Now you can see that your right arm moves up and back very comfortably like that. We're going to aim for that with this arm. And you can see it feels a little resistant to going any further than this, so that we've lost a little bit of range in your shoulder, but we'll get it back. So what I would do at home is have a large pillow right here and let the arm stay in this position for about 2 or 3 minutes. After a little bit of time, it'll be ready to go a little bit further, a little bit further. Again, you don't want to push it or have the family push it hard, because that'll just make it painful. It'll pull back if it's painful. So we're going to move in this direction. So we've loosened up the shoulder, we've loosened up that rotation. The next thing your family can do is gently move the arm above your head. And I wouldn't have them go too much further than that. It's stopping right about there, but I actually wouldn't go too much further. The other thing you can try at home, go ahead and put your hands together like you're praying. And you're going to go up overhead, moving yourself only within a comfortable range, and it has to be really slow. Sometimes your speed is very fast. So I would go about half your normal speed. And down and up. That looks great. Come all the way down and rest. So those are some ideas as to how to keep your shoulder in good shape when you're laying down. One of the things I also did is I put a bolster under your knees, because sometimes if the hips and knees are flexed, it helps the arm stretch up higher. It's how the body works.